Many parents in the largely Latino east side of San Antonio face poverty and lack health insurance, and a child with a cold means a hospital visit.
A lot of the kids were taken to the emergency room, and parents did not practice taking them to preventive care. They didn't have a doctor that they would say, this is my pediatrician, or this is the doctor that I take my child to. If they got sick, if they got a cold, unless it was an emergency, they would take them straight to the hospital. So there was a need to educate the parents and to let them know that let's avoid those emergency trip visits. You need to build a relationship with your local pediatrician.
Noemi's group wanted to create a medical home where local families with children ages 0 to 5 can regularly visit a doctor who provides continuous, preventive, comprehensive care. But how? They decided to train parent facilitators who live in a neighborhood to go door to door, visit with families, identify their needs, explain why a medical home is important, help parents set up appointments at clinics, follow up, and connect them to other resources.
They said, well, if we're already going to be knocking on doors, we might as well also connect them to other services that Eastside Promise neighborhood has to offer. What if that mom who doesn't have a medical home for their child also has a 15-year-old who's in need of enrolling to a physical fitness program? We're already there, why not also connect them?
The group formally launched its Community Connector program in 2016 with 3 parent facilitators who connect families to partner clinics that are able to provide a medical home.
What makes this program different is the hand-holding that goes along with it. It's not just you need a medical home, well here's the information on the health clinics in the area. It's really about, let me sit right here with you, let me call the doctor, and let's schedule an appointment together. If they say, well, I need help with bill assistance, well let me show you where you can go and get this. Here's the phone number of the person you need to reach.
Part of the development of the program was also ensuring that we hired people from the neighborhood. It was very important that we also provide employment to residents in the neighborhood who maybe have not had an opportunity to have access to a job or apply to jobs.
Parent facilitators also referred families to fitness programs, healthy food options, and services offered by partner agencies like HIS Bridge Builders.
A lot of the residents are getting involved or getting services. Many of them do have at least some basic medical coverage, but I think they're more aware of some of the other activities in the community, like the physical fitness activities we have at some of the other providers. We also have a farmer's market. It's just an awareness that there's other options and giving them the opportunity to participate.
The Eastside group hopes to add more connectors to further reduce barriers to healthcare.
The primarily long-term goal for this program is for us to be able to say that every 0 to 5-year-old child in the neighborhood has a medical home. That already in itself is setting up the child for success when they enter day 1 into kindergarten. If we're able to successfully connect every child to a medical home, that's what we would determine as we've met the goal of the program.